Hello, welcome to the Doctor Kirstin Show. I'm your host, Doctor Kirstin Lauritsen, and today we are going to talk all about endometriosis. This one is, I said this has been coming for a while. I did a really awesome free workshop on hormones. I called it uh, Hormone Alchemy because, as you're going to hear today, one of the things that's really key with any of the conditions that are out there, whether it's PCOS, endometriosis, fertility, is that we really we tend to look at a lot of it from a nutrition, inflammation, immune system, gut, like a physical body condition, but it tends to miss a lot of the information out there. It tends to miss the other components that impact stress, that impact that actually don't take into account how you grew up, how what has made you you has and the state of the inner body and how that has impacted the physical body, now in health and all of those things. So the reason why I called it hormone alchemy was because alchemy is a transformation. It is a change that happens. And what I have found and that you're going to hear today is that it's really important that we consider that part when it comes to endometriosis or any hormone condition. I would say, as if you've been around here for a while or you listen to any of my other podcasts, you'll hear a lot of that is that, it is not just about the physical body, but it is just as much about the emotions and about what's going on in the mental space, as well as your spirit or your energy or soul and the spiritual journeys that we have here as well. So let's jump in first and foremost. And also I will put a link in the show notes to the Hormone Alchemy workshop, but let's dive into this episode today. So, what is endometriosis? This one is really, really close to my heart because this is one of the reasons why I got into becoming a functional medicine practitioner. I found actually a lot of help through nutrition and chiropractic, which is what led me to becoming a doctor of chiropractic. But then I also realized how impactful nutrition was, and I was looking at functional medicine and everything that they were talking about as far as getting to the root cause, and really looking at the body as a whole. And so I was really intrigued by that. So I got my master's in human nutrition and functional medicine. At the same time, was trying to figure out what was going on with my gut, working on these symptoms for endometriosis. And then on top of that, I also had migraines. And so as you can imagine with those kinds of symptoms, which is really whether or not you have these kinds of symptoms, it's also really common for my patients to and clients to also experience the effect that these kind of chronic illnesses and pain can have on your life, right? So we're going to talk a little bit about that today. When chronic pain being one of the things that can really have a significant impact on how you show up in your life, because for some people who have some symptoms that are really bad, this can lead to hospitalizations and not being able to go to work. We're going to talk about all of those things. But being in pain every single day or every single month, it's not the best, right? And also, we're going to talk about some of the things that I would always think as well. I used to think that I hate my period and that, my it's the worst time of the month, and I would say and think all of these things. And it's really important that we pay attention to that because that's what you're telling your body, right? Is that you hate your period, you hate your body, you hate the way that it's acting, it's always working against you. And if you've been around here for a while, you know that those kind of thoughts are really, really important in almost a negative way, right? Because that's essentially what you're telling your body to repeat over and over again to itself, which is only going to manifest as more of that problem, right? So changing our our relationship, both mentally and emotionally and physically with our body, can have much more significant impacts on the disease itself or the symptoms themselves than just even doing the physical stuff. So again, we'll talk about it, but I was diagnosed with endometriosis when I was young. Although I had the symptoms, but I was not given like an official diagnosis until I was 18. And that was really because it was becoming pretty problematic. And some of the only ways to really deal with it at that time, they don't, even still to this day, we'll talk about some of the new things that are coming out for diagnosis, but they don't really discuss, they don't, really officially diagnose it necessarily. They just look at the symptoms and kind of say, yeah, this sort of matches this presentation. Therefore, we think you have this. And then one of the most common things that they do to treat it is they say, well, let's just put you on birth control. And then we will, you just don't have to have a period. So therefore, you won't have the pain and all of those things. But the problem with that is that number one, it doesn't actually, get to the root of where the problem is. And so if there's underlying, well, there's going to be, but if there's underlying inflammation going on, if you don't make any other changes and you just go on birth control, then we can start to see other problems start to pop up, like other autoimmune diseases and other issues, because we're not actually addressing the problem, right? So just going on medication and just going on birth control or any other, type of thing without actually addressing what's actually causing it can, create problems down the line. One of my most favorite things that they talk about, right, in functional medicine is they say, if you don't actually get to the root cause, it's like you have those burning coals underneath that are just, you might have doused the fire, so to speak, in the flames, but the coals are still there. And so they'll still continue to cause problems in other areas, if it's not addressed, right? And as we're going to talk about, when you really look at these things, what is actually happening in the body when this stuff starts to happen is that your body is starting to say no. It's starting to say, hey, the patterns that you're playing out right now are not in our best interest. And so we need to make some course corrections. We need to change what's happening here. And if you are not actually listening to the things that your body is telling you, I call symptoms like your body's way of communicating that something isn't right, something's wrong. But what we tend to do is we tend to think of that in the sense of like, oh, it's something's wrong, must mean I need to change my nutrition, or oh, it just means I need to, work on my sleep, or oh, it just means I need to like manage stress better, or I just need to take some more supplements, or exercise more, move more, whatever. But we don't actually think about the other patterns that influence these things as well. So if you physically are not going to, so if you are like mentally, emotionally not going to make the changes to stop the pattern, then your body physically will tell you enough is enough. And it will physically force you to stop. We talked about this actually last week a little bit with like the crash and burn of like the body will let you go for so long until it's like, okay, you have no longer listened to me. So now we are not just depleted, but we are in full out burnout and overwhelm. And now I'm going to force you to stop. And this is so important when we talk with moms. And this is why I created the Functional Motherhood program, is just because we are looking at burnout, I would say, through the wrong lens. And it's really important that we learn how to support the body in all aspects, not just your physical body, but also in the mental and emotional well-being as well. Because when you are able to do that, we're not just getting to the root of the physical symptoms, but we're getting to the root of what is causing the burnout patterns in the first place. Again, we're going to talk about a lot of that here today. But I saw a quote today that I thought was really just perfect. And it's from Sue Gaines, and it is, your best is what you can do without harming your physical or mental health, not what you can accomplish when you disregard it. One of the things that we talk about so much here is how you can really be at your best, right? As a mom, as someone, if you at your job, as in your partnerships and relationships, is really being able to be the best you can be, the best version of you. But unfortunately, I think sometimes people confuse that a little bit. I like this landed so much, is that your best is not what you can do when you continue to push, right? When you continue to push past your limits. Your best is when you're able to be your best and maintain your physical and mental and emotional health. So good. All right, let's jump in. So, what is actually endometriosis? Endometriosis basically happens when tissues have grown, like uterine cells, uterine tissues have grown outside of the uterus, which then sometimes can block fallopian tubes. They can cover ovaries. They can land in the pelvic region, right on the bladder. They can end up on the rectum. They can end up in the gut, and they can actually get into other places as well, in the body. And so, when these tissues then are outside of the uterus, then, this can not just lead to painful periods, but now you can have pain throughout the entire pelvis or in those different regions. And it can also lead to scarring. It can lead to organs starting to, close up, including the GI tract and leading to obstructions, and things like that. So it's really a very interesting disease or condition that happens. Some of the really common symptoms, and of course, then too, whenever you would be on your period, it can then really create a lot of intense pain because it's not just happening in cramping in the uterus, but now it's in more places than just in that uterine lining. So some really common period symptoms would be painful periods, sometimes called dysmenorrhea. You're potentially going to see a lot of pelvic pain and cramping that can start, before the period and last for days after, which was a really common symptom of mine, which has been a little bit wonky now, not having endometriosis and not having the symptoms anymore because I have figured out how to really get to the root of it. Without medications or anything like that. Again, more of what we're going to talk about today. But ultimately, like what would happen is I would know that my period was coming because I would get the similar cramping, and things like that. But not having it anymore, I don't have those signals that my period's coming. So it's been sort of like it's surprised me, which is such a new thing for me. And some other common symptoms are like lower back pain, stomach pain, pain during or after intercourse, pain during bowel movements or urination, especially before or during a period, and especially if you have those lesions that have grown onto, right, those other organs. Excessive bleeding, fatigue, bloating, diarrhea, constipation, nausea, because of the amount of pain, that can really be there. And I would say too that, some things that are really common for people that have endometriosis is it can really start to impact your daily life, right? So if it's making it difficult to get to work, to get to school, if it's really hard to go throughout your day comfortably, this can be a really big sign that it is time to do something about it, right? If you're a mom, right? And although we are going to talk about infertility today a little bit, that is associated with endometriosis. But if you're a mom, like being a mom doesn't stop if you're sick or if you're in pain, right? You still have to be a mom. So, it's not going to be very good if you're going to frequently end up in the emergency room, right? Or if over-the-counter pain meds aren't really starting to cover it anymore, or it's taking, hours upon hours for you to get that pain under control. And one of the things that I had as well was migraines too on top of this. So if I was starting to really get to a point where I was missing out on a lot of my life, or I was having to take a heck of a lot of like um NSAIDs, over-the-counter pain meds, things like that. Um and it can be a bit of a I was starting to also worry about like my GI tract because of the over-counter medications that I was taking, and I was taking a lot of them because I had to take like 4 pills every 4 to 6 hours to really keep the pain under control, especially those first couple of days. So this is what I'm talking about, right? Is that the pain, and for some people that doesn't even cut it. So these are, some things that we really want to be aware of. And it's not just always during your period, right? You can also get pain around ovulation, which was also something that I used to experience because I had scar tissues and evidence of it being on my ovaries as well. So, and then too, depending, that's not always the only time that women can experience pain as well. There's other symptoms that also are usually associated with endometriosis that can be pain with intercourse, bladder pain, or pressure. We even, of course, like heavy bleeding, but not with everyone. And we'll talk a little bit about why that heavy bleeding happens, just because of progesterone levels and estrogen levels, the thicker lining, which can certainly then lead to heavier periods because the higher your estrogen levels, because endometriosis is estrogen dependent, it can lead to having higher estrogen levels, which we can see on labs. We're going to talk about that closer to the end. But because of that, then that influences the lining that is created. And therefore, then if it's a thicker lining, then most of the time you'll have, or you can have thicker, heavier bleeds and even longer bleeds, right, than what we see on average. Infertility is also really common. It was a concern that I had prior to it, and prior to having my daughter. And I'm just still so grateful that I found the tools that I did before that. And I think again, I look back at the decade plus that I have been in school and looking for solutions and searching for solutions for endometriosis, and the unrelenting. I mean, really, like I was on a mission to find the way to heal and to really get to the root of my symptoms. I never stopped. I tried all sorts of things, acupuncture. I saw multiple different naturopaths, lots of stuff, as far as nutrition goes, and constantly chiropractic and seeing multiple different kinds of chiropractors. I'm also certified in applied kinesiology and neuroemotional technique, and these other alternative medicine techniques, even outside of chiropractic, because I was just constantly trying to figure out what is it that is it going on with my body that it is creating this particular expression. And so, I spent a very, very long time trying to figure out why this was happening, and I've tried so many different things. But and then I also got certified in neuroemotion. I'm sorry. Then I also got certified in neurolinguistic programming, and then when I was really digging into changing what was going on in my subconscious mind, that was then creating the genetic expression of this. If there are genetic components to this, but I don't actually have a history in my family of endometriosis. But the genetic expression of it, whatever it was that was then creating or causing that expression, is then, getting to the root of where, some of those patterns and things come from, which again, I've already said, we're going to talk about some of those things. Other symptoms that can come up too are, PMS, low mood, depression too, because being in pain and being in chronic pain, a lot of the time there is overlap with some of the causes and the nutrient deficiencies and inflammation and the other things that can also create and cause depression. But on top of that, being in chronic pain is also very hard on the mind, right? So there's that. And then on top of that too, depression as well can be a sign that our nervous system has gone past the point of really far gone past the point of being able to cope with stress. We would call this your dorsal vagal, your vagus nerve, and your nervous system has gone so far past that it is so depleted that, it cannot really function anymore. And so this is another way that I really look at working with my clients, is because if we're in that burnout overwhelm, like we're really, at a point where we're so depleted, we've got to be looking at what else, is going on there. And depression is one of those things that's a really common symptom that comes along with this. And then, of course, digestive symptoms, because which is in a large majority of people who have had endometriosis, just because it's in the pelvic region, right? And so many of the different nerves that are innervating the pelvic organs, also, if the whole pelvis is starting to be inflamed, then we oftentimes do see digestive symptoms there too. Plus, in addition, pain and other things along the lines there too. Now, just because I said that, endometriosis is estrogen dependent, we can also see low estrogen on certain labs as well and still have the symptoms of endometriosis. So this is where it's really important that we don't lock ourselves down on, like, it has to look this way on these certain labs, and it has to follow this gold standard of things, because people can still have the symptoms of endometriosis, and they can have the cells growing outside of the uterus, and have all of these symptoms and have it still not necessarily be following a strict way that it's going to look on labs. And I mentioned this as well, infertility is 6 to 8 times more common with women who have endometriosis compared to fertile women. So this is just a conversation I think that is really, really important, especially to see that I talk a lot now more recently to moms, and when we're considering the health of women and being able to really support women to getting the care that is absolutely deserving. One of the things that a patient of mine said just a little bit ago, she goes, well, I'm just so frustrated because every time I go into the doctor's office, they just basically tell me like, oh, either that the symptoms are in your head, or that there's no reason to test your hormones unless you're wanting to get pregnant, or maybe that you want to go on birth control or something, and that's the only reason. And she has very legitimate symptoms to have her hormones tested. And so these are the kinds of responses, also red flags, that I see a lot inside of the medical system. But it is leading a lot of women to going undiagnosed, and that they are not getting the treatment that they need and the care that they need in order to actually be able to function well. Because the fact is that if you are living most of your life, and even this is 7 days out of the month, that is a lot of time to be in pain. And if you are living the majority of your life, your months, your years in pain, that is taking away from you being able to live your life at your best. So let's talk about some of the diagnosis challenges, because here we are. This is what I'm talking about right now, is that most of the time women are diagnosed between 25 and 29, because if we're starting to really look at like infertility, rather than pain, and we're looking at, all of these things, this is a time where most women tend to get that diagnosis. But, like me, my symptoms started when I was 12 or 13, and I didn't really receive a general-ish name for it or diagnosis until I was 18. But then because I went on birth control, that's actually when my migraines started. But I was already having issues with like my gut and my immune system and things like that. So, the signs were there, but usually diagnosis is really, really hard for endometriosis, which is why it can be really tricky. We don't have a specific blood test yet, although I'm not sure. It might be coming out soon. I'm not sure. But anyway, there is a blood test that is being passed around. They're kind of testing it right now to see if they can look for the diagnosis of endometriosis through the blood. Although right now you can't necessarily do that. And then there is the potential for getting a diagnosis with ultrasound. Again, I'm not super familiar with that either, but there are some things that are coming around that are getting some pretty good accurate diagnoses of endometriosis. But usually, like the really official way is they would go in to like, remove, they call it excise, to remove the cells from the pelvic region, and then they would biopsy it. And this is all done through laparoscopy. So they would then take out the lesions, they would biopsy them, test them, and let you know if they were, endometriosis or not. But that requires you, going under general anesthesia, and it's kind of a whole thing. So they tend to not really do that a whole lot because it's a big ordeal. So instead you kind of get this idea of like, okay, well, we think that this is what's wrong with you, so here's what you do about it. And most of the time it leads to a medication of some kind that's basically going to cover your symptoms and have you like not have your period. And that's like the extent of it. But then the problem is that then when you then go to, potentially start having a kid or getting pregnant, well, if there's still an underlying problem and you are having issues with infertility, right now, this starts to become a little bit more serious in the sense of like, and I think this is where people start to get diagnoses, but they also get delays in diagnoses because now we're dealing with an infertility, thing as well. So Lots of really interesting things to look at there. There's some root causes, and I'm going to discuss some of like kind of the mechanisms behind endometriosis and what we think may be, causing it. But I will say this is that some of the literature is still pretty mixed. And I think this is where it's really important to work with someone like functional medicine and integrated medicine is really about looking at the whole picture, right? So looking at how each organ system is all functioning together and it makes a really big I think it's really, really important than just like saying like, oh, we're gonna not look at anything else, and we're just gonna look at like the pelvis and the organs that are in the pelvis, and particularly the uterus, and then that's all we're gonna do. It really kind of falls short, in terms of looking at what other things are going to be impacted or are impacting this particular condition. Again, no matter what we talk about here on this podcast, we're always going to be looking at it, but from that perspective. And functional medicine does do a good job at also acknowledging that and that the emotions, that stress, your spiritual body, your mental, like mental emotional state is is important when it comes to this, but I even found that some of the tools underneath that kind of fell a little bit short. So that's where I went and got additional training and certifications because I found that there were these massive gaps in the patterns and mental emotional things that and setting boundary we'll talk about some of that, but there were big gaps as far as supporting that side of things and really looking at it from the perspective that anything that happens in the body that is like an out of balance, anything out of balance is really a good example of when the body has lost its capacity to cope with stress. And that's not just talking about like your work stress or financial stress or life stress or relationship stress or anything like that that's currently happening. This is also taking into account what's going on inside the body as well. So when we're talking about root causes, we're not just talking about your hormones, right? Of looking at looking at estrogen and progesterone and testosterone, and all of those things. We also want to think about your immune system because one of the things that is pretty common with endometriosis now is that it is being looked at as an autoimmune disease or has some kind of autoimmune component. So when we're looking at the immune system, we're obviously going to talk about the gut. But one of the things also that is looked at right now is there's a pot. So no matter they did a study looking at women who had what we call retrograde menstruation, which can happen in people who have endometriosis and people who don't. So in this study, they looked at both and they found that there was a presence of retrograde menstruation across the board through the control group and the women who had endometriosis. But just having retrograde menstruation, where cells of the uterus and blood, make it out the fallopian tubes and into the pelvis, did not necessarily dictate whether or not those cells then implanted into the pelvic region. So that, kind of says that like, yeah, retrograde menstruation is a part of probably is of how those cells got there. However, it does not necessarily mean that you are then going to have, endometriosis and that they're going to implant and then they're going to turn into, an issue. So again, when we're looking at these causes, we have to think about why is the body doing what it's doing? What is going on with the internal state of this body that then it is implanting and then creating this expression of this disease? If you are wanting to learn more about that, you can look at the previous episode that I did because we talk about that a lot, and looking at the stress disease connection between what is actually happening in the body that is then creating that environment for this to happen. Now, when we're also talking about, the immune system, immune dysfunction, there's also another theory of potential like bacterial contamination. So we talk about the GI tract, and there have been very specific microbiome changes that they've noticed that are differences between people who have endometriosis and people who don't. And that's really, really important because your immune system and your gut are so intertwined and they are so interconnected that, it's especially too if we're looking at endometriosis as an autoimmune, kind of condition or behaves a lot like an autoimmune condition, then we need to be looking at the immune system. We need to be looking at inflammation. We need to be looking at, all of that. And you cannot do that without looking at the gut. And there are some theories that yeast, the presence of candida, so anti-candida treatments sometimes can be really, really helpful in cases of endometriosis, as well as looking for the presence of E. coli colony formation, which is also fairly common. And there was a study that I was looking at that looked at they were studying the menstrual blood of women with endometriosis in comparison to a control group, and they found the presence of, E. coli concentrations. And then on top of that too, there's other types of bacteria like fusobacterium, things that we can test for on a GI panel that when they are present, they're just things that we want to be paying attention to. There's also, too, when we're talking about like the immune system as well, we want to be also thinking about like, why is it then that some people's immune system reacts and then creates this inflammatory response versus others where their immune system just cleans up the retrograde menstruation, the cells that have gone through the fallopian tubes, and they just get rid of it, right? It just cleans it all up. What's the difference there? There is definitely a genetic and epigenetic factor here for sure. If your grandma, mom, sister has endometriosis, then you are much more likely to also have endometriosis or a diagnosis of it. And um, they've looked at some ideas that maybe there might be have been like a toxin that your grandmother was exposed to that then now leads to you potentially having this particular expression of endometriosis. They've also suggested that maybe if there was like a low androgen exposure when you were in utero that could lead to epigenetic changes, to then having that hormone production imbalance as well as the sensitive tissue. Also looking at toxin exposure, which we're going to talk about in a little bit because you can't talk about this without talking about toxins. And there's some other things as well. I'm not going to go into them today. I was thinking about that I might go into them, but I think that for now, sticking to some of these other things would be more helpful. But just know that there are a lot of things that people are looking at as far as different types of enzymes that are dependent on certain types of vitamins and minerals, like zinc, for example, that could be a part to why people are have endometriosis or why they're getting it. And then I also don't want to forget oxidative stress and then, of course, neurogenic inflammation. So, especially with oxidative stress, and you're going to hear this a lot, in terms of any kind of disease or inflammation or condition in the body. And it was something that I talked about a lot with athletes, because oxidative stress, especially if it's high, can start to lead to fatigue. It can start to lead to body breakdown, and it can start to impact your mitochondria, which are really, really important energy producing cells. And oxidative stress can happen from athletic training, of course, but it can also, we can see it from, an increased load from environmental stresses. So that can not just be your work environment and all of those things, but that can also be the types of chemicals that you're around, the types of chemicals that you clean your home with, the things that you put on your skin, things that you're smelling, especially if you live in a place where pollution is pretty high. All of those things are really important. Also looking at if your diet is really low in anti-inflammatory and antioxidant foods, all of those things are going to be really important when it comes to how your body deals with oxidative stress. We also see with oxidative stress an increase in inflammation, where we see also increased lipid peroxides. We see increases in macrophages, which all of these are signs of increases in inflammation, which when we're looking at an inflammatory condition, these things are pretty critical, and we want to make sure that we're supporting the body and being able to do its job well, and reducing inflammation, right? So I also mentioned this concept of neurogenic inflammation, which is essentially where the there's a nervous system and immune system connection. In the previous episode, I talked a bit about psychoneuro, immuno, endocrinologic connections, or the study of it. And we talked a bit about the HPA axis, the hypothalamus pituitary adrenal axis, which is at more or less at the center or the root of that, of how the body connects the neurological systems, the hormones, so the endocrine, the psycho, which is the your thoughts, your behaviors, your emotions, and of course also the immune system, and literally how your body deals with stress. That HPA axis is at the root of all of it. It controls all of it. So, it's really, really important that we don't neglect stress. And this isn't just the stress, again, that you see in your life. It's also looking at the hidden stressors as well. And also, I think something that's really interesting is that endometriosis lesions are highly innervated in a way that normal endometrial cells are not. So the normal cells that are in your uterus are not as connected to the nervous system as the lesions that end up in the pelvis. And there's a really I would say there's a really important distinction here that I think needs to be made when we talk about neurogenic inflammation, because there is immunogenic inflammation, which is where there's, your immune system is really plays a really big part in inflammation, and it is the very first protective and reparative response generated by the immune system when a pathogen enters the body. While when there's, and this is really important, when there's neurogenic inflammation, it involves a direct relationship between the nervous system and inflammatory reactions. Again, why would that happen? Looking at what is happening in the nervous system that is then responding to the immune system and creating this inflammatory effect. Studies, and this, I'm going to take this a step further, studies across the board, there have been many, many, many studies that have looked at and shown a relationship between traumatic events in childhood and later developing chronic pain and these kinds of conditions. Also, we know that post-traumatic stress disorder increases brain inflammation and the nervous system inflammation. And then on top of that, we have also seen that emotions, including shame and others, can increase inflammatory markers like cytokines and interleukins. So when we're looking at how is the body, I really want to shift the perspective of how we are seeing chronic conditions and really be paying attention to how our, and again, you may not look at your past as, trauma, or, and many of my clients come to me and say, well, I had a happy childhood, my parents were great, all of these things. But then when we start looking, they will start to say, oh, well, I did have a really hard time at this particular school, or we moved a lot when we were younger, or I was bullied, or I had, things like that, or times where there was just a really high stress, but they wouldn't describe their entire childhood as traumatic or anything like that. And then there's the flip side where there are a lot of people who would say, yes, like I had a really, really tough time, like a parent died, and then, or they experienced abuse, or they, had to take care of their younger siblings at such an early age, they kind of were, or they were parentified in some way, shape, or form, right? There are these really these things that then happen, depending on where you grew up as well. I've had clients who grew up in other parts of the world where, there was just a lot of stress, and it was just really, really hard, during those times. So there are a lot of different things that can contribute to this that you wouldn't necessarily say are like trauma specific. But there's some big pieces there. Now I did start to mention this, but I do want to talk a bit about some really like what I would call key contributing factors, right? So starting off with hormones. This is going to be a bit of a long episode, but I think it's really important that when we look at this because I think that there you usually get bits and pieces, but I want to make sure that this is really comprehensive when we talk about these conditions because there's so much that can go into it, and I've also seen so many clients who have been like, well, I've tried this and that kind of helped, and we did this and that, maybe didn't really go so far, but then there's big gaps, of other things where that are really, really important. So when we're looking at hormones, we're not just looking at estrogen. Estrogen is important though, because estrogen, especially when endometriosis is typically a diagnosis or a disease that has higher estrogen. And estrogen stimulates endometriosis cells to be, created. It influences that cell lining. So, if we have higher estrogen levels in the body, then this can start to stimulate endometriosis lesions, and it can then continue to cause proliferation of those cells. Also, something very interesting that can show up in some people with endometriosis is a resistance to progesterone. Usually, when progesterone is low and on the lower side, it can lead to, higher estrogen levels, but it also doesn't counterbalance the estrogen that's there. And when progesterone is low, it would usually be the hormone that would slow down lesions, and would slow down the growth of that the lining in the endometrial lining. So when it's low, then we see that. Now, also low progesterone can also cause some mood imbalances as well. Like it can be really, really important for anxiety. It can actually help to calm down one part of progesterone. There's a couple of parts, but one part of progesterone, especially when I see that it's low, I typically see women who have a hard time calming their mind down. They feel very anxious. It's one of those things that can tend to drop and cause these kinds of symptoms. Now, being on the high side as well, if there's like really, really high progesterone, that can also cause anxiety as well. So this really just goes to show that balance in these hormones is really, really important. And we're also going to talk about stress and cortisol and how that all impacts these hormones as well. So when we're looking at, I think it's really important that when we're looking at estrogen, when we're looking at progesterone, one of the first things that we consider is that stress robs it's the first thing that will start to cause problems with estrogen, progesterone, and testosterone production, partially because cortisol that's produced in the adrenals, same as estrogen, progesterone, and testosterone, as well as like the ovaries, but the adrenals is where it all begins. If cortisol is high and it's chronically high, again, losing the capacity to cope with stress, then what you're going to get oftentimes is what we call cortisol steal, where the adrenals will essentially shunt all of the nutrients that you need in order to produce all of these hormones and give it to cortisol because cortisol is so high, which is one of the reasons why when I test, we incorporate the Dutch testing into functional motherhood. Because I want to make sure that we are testing for cortisol and we're looking for it because imbalances in that can tell us a lot about what's going on with your hormones. But then we also want to consider the thyroid because especially with any imbalances as well as period problems, your the thyroid also can be implicated because it's one of the first places that if we're looking at endometriosis as a partially autoimmune condition, the next thing that tends to happen is we get some kind of thyroid diagnosis after that, whether it becomes autoimmune or not. But hypothyroidism, Hashimoto's, testing for thyroid antibodies is really important, especially if you've had it for a long time and it's kind of gone untreated. Or we talk about that, those coals burning, like we've been taking medications, but we haven't necessarily addressed the root cause. This is when we start to get additional autoimmune diagnoses on top of the ones that we already have, because the immune system and the body is basically saying like, okay, there's a problem here, there's a fire burning, and we need to get rid of it. But then when it goes it's like a fire, right? Like when it goes and is allowed to just do its thing, it's going to start burning all over the place. And so we want to be looking at the thyroid there as well. But really, like when we're also thinking about how is this impacting infertility, when you have like high stress, and again, that's not just in your life currently, but if you have an environment that has a lot of toxins and chemicals and things that are going into your system, if you also are, if you have a lot of hidden stressors from your childhood, and that is keeping, excuse me, if that is keeping your body in that fight or flight mode, excuse me, if that is keeping you in a chronic state of fight or flight or freeze or fawn, which is where we are always trying to keep our relationships, trying to keep them all like calm and peaceful, and doing a lot of people pleasing behaviors at the expense of yourself. That's really where fawn comes from. If you are in that chronic state, your hormones are not just going to take a hit, but also you are always going to prioritize survival over fertility, right? Like running from a lion or fighting a lion, that is not the time to reproduce, right? So what do we see? We usually see low libido. We see, a lot of these different symptoms that would be very helpful if you wanted to get pregnant, but those tend to go away because you are prioritizing survival. So if you're stuck there for, years and years and years, does it make sense, right? That like these sorts of aspects of the body are going to take a hit. But other, kind of factors that will contribute to hormone imbalance too, that also increase stress on the body, is blood sugar dysregulation and insulin resistance. So metabolic disease, if you are not eating enough food throughout the day and your blood sugar is just following highs and lows, that's going to have a significant impact on your hormones and can also have a significant impact on your weight and ability to lose weight and gain weight. If you have food sensitivity, so things like stress from foods or stress from your diet, whether you're undernourished, so not eating enough, if you have food, if you're around food, if we have any eating disorders or disordered eating, if we have, food sensitivities, all of these things can impact your hormones as well. Inflammation, dysbiosis in the gut, so an imbalance in the bacteria in the microbiome. Or if your liver is having an issue with detoxifying. So if we have a lot of exposure to what we would call xenoestrogens, all of these things can impact estrogen in the body. We're going to talk a little bit about that too, because that's one of the things that we can see on the Dutch hormone panel is how your liver is being able to process out these hormones. But one of the things too that I wanted to dive into as well, we're going to talk about environmental factors here in just a second, but one of the things that I do love to talk about with the gut is that, the gut microbiome is necessary for the health of you, and how that then affects the endocrine system, including digestive function, intestinal permeability. So if there's leaky gut or things like that, right, that can cause resistance to foreign pathogens, and can also start to stimulate the immune system. This is not the only reason why we get autoimmune disease, but it is one of the factors that we want to be paying attention to, because if, stuff is leaking through the GI tract, that lining that it's not supposed to, right? What's the only thing that we can do about it? We have to launch an immune response to it. And if that happens over time, we're going to start to lose resistance. And then that's when the immune system can start to cause other problems. It's one of the factors behind why we see a lot of food sensitivities and things like that too. But the other thing that I would say with that often gets missed is that if you think about the GI tract lining as a boundary between you and the external world, we also tend to see in people who have intestinal permeability that sticks around for a long time, an inability to actually hold boundaries in your life in general, right? Like hard time saying no, being around people who you don't like to be around or who are unhealthy for you, and yet you still allow them to step all over you or to, do any of those things. Setting really good boundaries is really, really important in being able to do that in a way that is also compassionate. And all of those things are important. But if you have lost that boundary in your body, we don't just want to look at it physically, like put you on a bunch of L-glutamine and sorts of things to, help out the gut, but we also want to be paying attention to why is that happening, in addition to like the imbalances that we can see in the microbiome and things like that. The microbiome obviously is also really important when it comes to, do we also have a presence of insulin resistance? So do we see a lot of like lipopolysaccharide endotoxins that are leaking through? Do we see chronic inflammation? The Western diet of kind of this like low fiber and a lot of white foods, as well as seed oils and these, really inflammatory kind of diets that, just don't have a whole lot of colorful foods and nutrients in them. These can all impact the microbiome and the type of bacteria that's there and lead to chronic inflammation and insulin resistance, lots of sugar, stuff like that. But then, if all of those things, if those endotoxins that are influenced by all of those things end up in circulation from intestinal permeability, this is where we can start to see things like, do we see irritable bowel syndrome? Do we see SIBO, small intestinal bacterial overgrowth? Women with endometriosis are so much more likely to have gut problems. So we see a lot of these really common symptoms that are happening with endometriosis. And really, I think something that's really important is that a healthy gut, a healthy microbiome that's balanced, it actually minimizes the reabsorption of estrogen from the gut, which then allows for the safe removal of it through the stool and the urine. Because one of the things that happens is when you produce these hormones, they go to your liver to be processed out, which means you need a certain number of if you look at the phases of liver detoxification, it actually needs a lot of vitamins and minerals in order to be able to do its job well. And if it doesn't have those things, what can happen is number one, it can get recirculated, but then once it goes through the liver, it then goes into the gut to be removed. But if we have leaky gut, if we have constipation, if we have any of these things that influence safe removal of it through the stool and the urine, then we can reabsorb that estrogen back in. And we can also see on stool panels the presence of beta glucuronidase, which would then tell us if there's a possibility that testosterone, progesterone, estrogen are being reintroduced back into the body. And can also influence if we have high estrogen levels or low progesterone or any of those things. And there's some other things I'm not going to go into now, but there's some other stuff that we can tend to see with endometriosis with like proteobacteria and E. coli that I mentioned, in the microbiome. And then we can't talk about this without talking about environmental factors and toxins. So I talked about xenobiotics, right, and detoxification. So one of the things that's really common to see with endometriosis and that's being talked about a lot more, which I'm so glad. I used to be the weird one that would like avoid. I was doing all of the like clean, makeups and removing all of the stuff from our house and not burning candles, right? And like doing all of these things, not cleaning my house with like vinegar and water and not, any of the other things that people spray into their homes or the laundry detergents that, make your clothes really perfumey and smell. And I was always the weird one that was like, looking at these the look fragrance free stuff, and all that. Partially also because it would flare up my migraines at the time. But what is now finally coming out is people are starting to learn a lot more about endocrine disruptors like BPA, right? Bisphenol A, and parabens and fragrances, as well as dioxins and PCBs, pesticides. So it was interesting that I was looking at a study that was basically saying that there was a it increased the risk of endometriosis if women were exposed to like pesticides, PCBs, dioxins. So I think it's really important that we mention it because the things that we clean our house with, the things that we where the environments that we live in, chemicals that we put on our skin. I will never forget. It's all really, really important. I'll never forget a study that we looked at in school in my functional medicine master's that was looking at the exposure that women versus men have to certain type of toxins by like 8 a.m. And men was like on average 7 to 12, and women it was like 80 to 100 by literally the time that they left the house. And I just remember being like, holy smokes. And then on top of that, I was also looking at another study that looked at the umbilical cord blood. And this was a study done in Canada. And one of the things that they found was that there were like a significant, I think 200 plus or more chemicals were present in that umbilical blood in a newborn baby, in a newborn child. And I just remember like one of the things that we were looking at is like, what is the potential impact that that could have, on the health of a newborn child, and how can that then impact, later on in life. And so I think it's just an important conversation to have because it doesn't mean that you're going to try and like reduce and you can never be exposed to toxins. But what it does mean is that the things that you eat, the things that you do, the water that you drink, things there are, and the things that you clean your home with, there are very, very big things that and easy things to do over time that you can, reduce your exposure, which is it's going to help. Although I won't forget to mention that, some of these plastics and some of these forever, chemicals, they're we don't have very good ways of removing them from the body. So again, it's I would say it's just really important that we are paying attention to how much, we're exposed to. And it can start to get really overwhelming. I mean, I've even experienced that before too, but one of the things I would say is that if you do start to get overwhelmed, I would start with a list and I would start chipping away slowly and just one at a time, like, okay, finish up or throw away your, clean how you clean your floors and your counters and just do like vinegar and water and start cleaning with that. It's been a long time thing that people have done. It works very, very well for cleaning surfaces and cleaning your floors and all those kinds of things. And it will significantly drop the amount of toxins and things that you are exposed to and chemicals. Again, same with like your laundry detergents, things like that. Easy, easy things that you can start changing and then over time change out your makeup, change out your, the things that you do your hair with, and all of those soaps, things like that, which we've actually started to make our own soap and are going to sell it because what we even realize is like even bar soaps and things that are touted to be safe are still have certain types of chemicals in them that can potentially I'm not going to say they are or not, but can potentially be problematic as well. So and I would also say this too is like I just tend to see that there are some people that will be like, well, that's probably not really that big of a deal. But when you have been someone that has had to try and find solutions for chronic illnesses, you start to realize like how much is around you and how much you can potentially be sensitive to. And so whether or not we necessarily have studies to prove or show that these are in fact having an impact on the body, you kind of just get to a place where it's like, yeah, but if I started to see an improvement in how I felt by paying attention to these things, then like, I mean, I'm going to take that, right? And I see this, whether I see it in studies or not, I see it in clinical practice all the time. So let's talk a little bit about what can you do, right? Let's talk about treatment approaches. So nutrition and diet. One thing that I would say right across the board is that blood sugar balance is incredibly important when it comes to your hormones. Whether we're talking about endometriosis or we're talking about PCOS or we're talking about premenopause or postmenopause or any of those things, blood sugar balance is so important. What this means is we want to make sure that you're eating enough times throughout the day. One of the biggest ways that you can actually treat brain fog is making sure that you're eating enough food and that you're eating enough times throughout the day. So 3 big meals, a couple of snacks, really, really important, as well as getting enough fiber and enough protein and then also making sure that you're building muscle. We don't want to forget about that. We want to make sure that you're careful of the types of like protein bars and other, sorts of things like yogurts and stuff like that that can spike your blood sugar, like juice, even certain types of yogurts and kombuchas, which are great gut supportive foods. But if they're going to be higher than 9 grams of sugar, and if protein is lower than the amount of sugar and carbohydrates that are in there, it's going to probably spike your blood sugar. And that's one of the things that will then spike cortisol, and then that can lead to an imbalance in your hormones. So we want to make sure that we're getting plenty of protein and enough fiber to balance it out. So, making sure that protein is higher, fiber is higher than the amount of carbohydrates that are in that meal is going to be one way that we can help to do that. We want to make sure that you're getting diversity of foods. So I talk about this, eat the rainbow. We want to get close to 2 to 3 colorful fruits and vegetables with every meal, as well as enough amino acids and protein because it's extremely important for supporting your immune system. And ideally aiming for 6 different, colorful foods per day. But don't get overwhelmed by that. It doesn't mean that you have to then, eat like a whole head of broccoli and, an apple and like all of the things. Even just starting with 1 tablespoon per day and kind of working up from there, is a good place to start and will also still count. So when you think about like if you put in like a half a cup or a quarter cup of onions and spinach into your scrambled eggs, and then you add an avocado and then maybe like an apple, like you're there, right? You're there already, or a banana. Other immune supporting nutrients that are going to be really important, like selenium, which is going to be a precursor to glutathione, which is going to be really supportive for your liver for removing toxins and removing hormones, all that kind of stuff. We get a lot of that from Brazil nuts, from shrimp, and from cod. But just note that, especially with like Brazil nuts, we don't want to be eating like full on handfuls. Like usually it's only a couple like per week that we really need. And you can actually end up with a selenium overdose if you eat too much. So just be a little bit cautious and careful with those. As well as zinc. You can get a lot of zinc from like oysters and pumpkin seeds, and making sure that we're eating enough fermented foods. And so I mentioned kombucha, I mentioned yogurts, also any kind of fermented veggie, sauerkrauts, things like that are going to be really important. And I will say this. Yes, we can use probiotics to help the gut, but getting those probiotic foods from your diet are gonna, we've seen it over and over and over again through research that it will stick around with the gut a lot better if you do that. Get it from food. And then, of course, iodine. So seaweed, nori, kelp, like seaweed snacks are going to be a really good source of dietary iodine, not necessarily supplemental iodine, which we also then need to be cautious around if we have some type of thyroid condition, things like that. But if you get them from food, it's going to be a lot better. Um, Also, I do want to mention that there are some foods to avoid when it does come to hormone balance, and alcohol is going to be one of them. That includes beer and red wine. I know that they say that red wine can be healthy for you, but alcohol in and of itself can be really problematic for hormones and for the liver. Coffee also being another one of those. I know a lot of people who cut out caffeine and coffee and feel so much better. And that is in part too, especially if we have fatigued adrenals or we're seeing a lot of cortisol steal. Not drinking coffee or caffeine can be really, really helpful there, as well as not drinking coffee on an empty stomach in the morning. That can be a huge factor for imbalanced hormones. Uh, and then there are some other foods as well. Like if we also are seeing like high histamine and things like that, then we might want to change some of the foods that are coming in from there too. I would also say as well, I do want to mention that there's some additional nutritional support that we can do as far as like vitamin C and vitamin E that actually was pretty helpful for if there was pain with intercourse. So vitamin C and vitamin E combined can be really helpful for that, as well as vitamin A, magnesium, selenium, vitamin D, which is really important for your immune system, polyphenols, B vitamins, particularly like B6. Some of those things and B12, especially if those two come back low on the Dutch panel. I'll start looking at something called methylation, which again, I'll talk about actually here in just a few minutes. But these are some big things supplemental wise that we can be looking at. But I also want to mention here too that if you are not eating enough food, so low calorie diets, not only do we see issues with blood sugar issues, but with restrictive dieting, it can reduce T3, which is a particular thyroid hormone, which then can cause the metabolism to slow down, and it can really make weight loss a lot more challenging. So we do want to really be and then it's really important that you work with someone over time to rebalance your hormones, to then, start seeing progress there. But there's a lot more that, is going to go into that, because we've got to start looking at how your relationship with food and your mindset around food and dieting and all of that. We basically have to rehabilitate your body and how it has been seeing it getting enough resources and nutrients, and enough calories. Other things that we want to do for like gut health is making sure that we improve the microbiome, that we are eating enough prebiotics. So that includes fiber. Are getting lots of variety in foods. We want to make sure that you're having at least one bowel movement a day. I mentioned constipation and how problematic that can be. You'll often sometimes see too, like increasing fiber intake and then also making sure that you're staying hydrated with filtered water, and increasing that water intake, getting enough movement, which is so, so, so important. And we do want to make sure that we're careful around antibiotics. If you at any point in time had 3 rounds of antibiotics in 1 year at any point in your life, we definitely want to be looking at the gut. And then there's things like calcium D-glucarate, which is a supplement that you'll sometimes see if on your gut lab there was high beta glucuronidase, which I mentioned. Again, I know that's a big word, but basically just saying that if that is present in the gut, that is a supplement that we will sometimes use in order to help reduce that so that those hormones and toxins aren't being recirculated back into the gut. But that is not a long-term solution. We want to be also making sure that we're changing the types of bacteria that are in the gut so that we don't continue to have that problem, later on. I did say that I'll mention methylation, but talking about detoxification, talking about methylation, some people are starting to learn COMT and MTHFR. These are genetic issues that can happen when you are not very good at methylating B vitamins, and then that can start to cause problems with things like the production of dopamine and epinephrine and norepinephrine, which are part of how you manage stress. And COMT is really critical for the phase 2 part of detoxification in the liver of removing estrogens, right? So if we have issues with methylation, which is where, we need these methyl donors to basically be able to deal with B vitamins and turn them into something that's usable. And especially too, if you are getting in some unmethylated B vitamins from certain types of foods, like folic acid is usually in a lot of like your cereals and your breads and milk and things like, well, I don't know if they put it in milk, but definitely in cereal and breads and stuff like that. They will reintroduce those vitamins back in, but they won't do it in the methylated state like it usually is when you just get like whole foods. Instead, you get the folic acid, which then puts more, your body has to find a methyl donor in order to turn that B vitamin into something that's usable. So, there's also certain supplements that you can take. Low quality supplements will not have a methylated form of B vitamins. And so if you are doing that and then you also have estrogen dominance, then we're going to potentially see, it puts a lot more strain and load on your liver in order to be able to remove those factors from your bloodstream. So obviously making sure that we're, supporting detoxification, that, the kidneys have enough, water, so they can remove stuff that we're sweating, that we have healthy bacteria, that, we are, lowering the risk of like constipation. All of those kinds of things are really, really important. Opening up all of those channels of detoxification are really important when we're talking about hormones and endometriosis and those things. So last thing I'm going to say, we're going to talk about hormone testing really quickly, but we also want to make sure that we don't just neglect the big gap that I typically see, which is that your nervous system. So stress in your nervous system are really important. One thing that can be really common with endometriosis is that there's a very high rate of dissociation with chronic pain and endometriosis, because what essentially kind of happens is that because of pain, like you don't really want to be in that body because it hurts. So you get very, very good at dissociating, at removing yourself kind of like mentally and emotionally from the physical body. You get really good at pushing down emotions, at burying them, at not feeling them and ignoring them. And sometimes, too, one of the things that I look at a lot with infertility and fertility for these kinds of patients and clients is the womb itself, because the body doesn't feel safe to you. The womb itself isn't really a safe place to hold a child because you don't think your body's safe. So then what would make it seem safe for you to have a kid in there? And I know I'm lots of compassion here, right? Because these things are really, really hard to look at. They're really painful, but this is where we need to start paying attention to how are we thinking about our body? Trauma, stress in childhood, or just even like hidden stressors from childhood, people pleasing patterns, perfectionism, learned beliefs and behaviors, guilt around asking for what you want or what you need, not knowing how to meet your own needs or how to have your own needs met because they weren't met as a kid or it was seen as a burden. All of these different patterns that tend to show up are really important, especially to how we are thinking about our body. And one of the things that we do a lot is we look at the strategies of like, what do you think? What are some of the first things that you start thinking? Like as soon as you start feeling that pain, what are some of the first things that you think, and following those strategies and those patterns through, because they are part of what then perpetuates that too. Perpetuates the disease and why it continues to happen. I know that sounds a little bit different because why would your thoughts impact your health? But if you are constantly pushing past your limits and not listening to your physical body and not listening to the symptoms and not listening to, because you have a fear of rest or because you have beliefs that are tied that your productivity is how you get your worth and value, or that if you are lazy, then you are bad, all of these things are really important. But we have to really change our relationship to rest and asking for our needs to be met and what it means for us to actually, rest, because I just find it so interesting that like that is literally what the body is calling for. And yet it's one of the things that people resist the most because we have so many beliefs and thoughts and societal programming and conditioning around what that actually means, including just like going out and laying out in the sun, not doing anything for a day. It's interesting too how many moms I hear that they, maybe don't get their to-do list done in the day and they feel like failures at the end of the day. It's one of the reasons why I created functional motherhood the way that I did, because I realized that like all of these things are all connected. So we're not just looking at hormones, but we're also looking at like how are you thinking about yourself and about, how you're functioning in your day and the roles that you play and all of those things. So they all matter. So if you are not actually addressing that, and I would say here too that I love therapy and I love counselors and I love all of the tools and the awareness and the things that they have. But if you are also not getting to the root and changing the beliefs at their core, then having awareness of the problem is great, but we actually need to change and rewire the brain to learn something new where it was created so that it can change the expression, later on. That is one of the biggest things that changed for me, was that I'd done a lot of those things, but and I was meditating and I had gratitude practices and I had done a lot of that. I used a lot of stress management techniques. I was, an Ironman athlete at that point, so I was moving a lot and recovering and listening to my body in those senses, but I wasn't paying attention to the other patterns that were there, and my body was literally asking me to rest, and I just wasn't listening. Okay, let's talk about testing and monitoring, and then we'll wrap this up. So, some of the testing that we can do, I really love the Dutch hormone test because we can look at how well how your hormones are being utilized, but we can also, and how they're being created, but we can also see how you're eliminating it. We can also look at some of the organic acids that are associated. Do we see are you low in vitamin B6 and B12 and some of those things? Do we have some methylation issues? We can look at all of those things, on this panel, and there's so much more that we can get into. I also really like looking at the thyroid and getting thyroid antibodies. And then I also really like looking at the CBC with a differential. There's so much that we can get from just that. If we know that if like iron is low, then, that's going to be absolutely impact your ability to lower inflammation. But then also too, if iron is too high, that can drive more oxidative stress, right, and increase inflammation. So really looking at both sides of that, we can see that on that CBC, and then your complete blood count, and then of course here too, if B vitamins are implicated, we can also see that on a CBC as well, and we can also look at your with the differentials where we're looking at your different immune system cells and things like that. So they give us a lot of detail as far as that goes, and then I also really love looking at the Dutch panel as well because we can evaluate for stress and how your hypothalamus pituitary and adrenal axis is functioning. We can see a norepinephrine and epinephrine and how those are being how those are being produced and what their ratios look like because they can all give us detail. We also look at cortisol and how it's mapping throughout the day, and all of these things are really critical because they can tell us how your body's being able to handle stress, and if you've lost the capacity to cope with stress and everything's really really low, or we're just seeing a really, really tired, body. I see this a lot with like my neurotransmitter panels. We know where we need to start looking, right? We need to start helping your body actually handle the stress so that then, we can do that. And I will also say this because I see this a lot as well, to the point that people who have conditions like this will often say, well, I'm not that stressed. And yet, when you look at it from the outside, they'll have like significant, like let's say financial stressors, or they'll have significant things happen with their partners or in their relationships, or they'll have this huge history of trauma in their past and and have all of these symptoms. But like currently, they're like, I'm not that stressed. I don't even know what stress feels like anymore. That right there are some signs and signals to be looking out for. We also look at estrogen levels, like we can see if any of any of the types of estrogen, we can see if they're too high or too low. We can see if they're actually being processed and removed by the liver. We can look for markers of inflammation and oxidative stress, on the same Dutch panel. So all of these things are testable. We can look at all of this, and this is stuff that I do. And sometimes with my private clients, we'll also run like a gut panel, and we'll look at micronutrients as well, because we really want to make sure that we aren't, missing any of those big factors that can really, really help. And I would say too that like sometimes people will do a lot of this was me. They will do a lot of like the nutrition stuff and the supplements and a lot of that and see some reduction in symptoms, but not full reduction. It's still going to have a really, really big impact on the like underneath the surface if you are doing a lot of the things that help to reduce inflammation. And if you have done that, and I have some clients who come to see me now that are like eat way better than I do now, basically are look like what I used to be like, right? They've removed gluten, they've removed a lot of inflammatory foods, they hardly eat any sugar, they don't drink alcohol, they don't drink coffee, they eat very, very, very well. And that's when I start saying like, okay, we need to start looking at some of these other factors like stress and these hidden stressors, because it's the next piece of the puzzle that's going to help with looking for that symptom, resolving those symptoms. Because oftentimes those things are missed, and putting it all together too. I think this is also a thing that's really, really tricky, is that you see a lot of physicians who have bits and pieces of the puzzle. And I'd say that one thing that I really love about how I've structured a lot of the stuff that I do is that it incorporates all of those things together. So it's like a comprehensive journey of, walking through what it looks like to heal. So here are a couple of options. So one of the things that I created was functional motherhood, because I wanted to be able to support women from the kind of taking like a full body approach, especially inside of motherhood, because it can be very depleting. It can be a lot of burnout. It can be a lot of overwhelm. So functional motherhood is essentially designed to give you all of the areas and addressing those mental and emotional pieces that are those hidden stressors that also do show up in motherhood, because they are in part of like the triggers that we experience with our kids. And, our nervous system doesn't know the difference between our toddler that's having a full on breakdown, right? And running from a lion. It just sees it all as stressful. So when we're able to give you the tools to regulate your nervous system and get you out of fight or flight, it gives your body the chance to take all of those resources that it was shunting everywhere else and actually put it where we want it, into energy, into healing, right? Into getting you more nourished. And that's some of the things that we have now included in functional motherhood, as well as nutrition and some of those other resources that are just really, really helpful for nourishing your mind, your body, and your soul. I just love it. It's full on comprehensive support. And it's a good 10-week program that gives you the place to start. And then if you're looking for more, kind of one-on-one private coaching support, I have higher level, more intimate spaces, private coaching. I have a couple different forms of what I call my deep dive, which is where we can really get you the support that you need. So if any of those things are, if you're looking for more support and programs like that, those are really, really good places to begin. And the links will be in the show notes. And I would love to see you in there. If you have any questions, come reach out to me on Instagram. Again, another link will be in the show notes. And I would love to chat with you and see how we might be able to help you get back to being your best, right? Like we talked about at the beginning, living at the best that you can. That doesn't mean at the expense of your, health, your physical health and mental well-being. It means that you are living your best, period, right? We love it. All right. Thanks for listening. I know this was a big one, but I hope that it's been helpful. Definitely come let me know if this answers some question for you, or it's share it with a friend or a family member, that might have this going on and that is having a hard time finding support. It really goes a long way. So, all right. I'll see you for the next episode. Take care.